Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, during winter, the cold air getting into your mouth causes the different layers of your teeth to contract. In most cases, the speed at which the inner dentin and the outer enamel contracts varies, thereby stressing your teeth. Now, this can result in increased sensitivity and discomfort. So, to discuss on the sensitivity of the teeth, we are being joined today by Dr. Banashri Bordoloi, consultant dental surgeon and oral implantologist from Dispur Polyclinic and Hospital. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So today we are going to talk on the sensitivity of teeth in the winters. Now, if we talk about the topic, but before that, we have to know about what is hypersensitivity. So on that note, what would you like to tell?
Actually, we have different layers of teeth structure, which comprises of enamel, dentin.
Okay.
And inside the tooth there is a soft tissue where there are blood vessels, nerves. So sensitivity occurs due to the crack in your enamel.
Oh.
And then when there is a crack, enamel is supposed to be the insulating layer, and then when there is a crack, then it exposes the dentin layer,
Okay.
which is a tubular layer, and it has direct contact with the nerves. And then what happens when any kind of cold or sweet food get inside that layer,
Okay.
then you have sensitivity.
Okay. Okay.
And in winters we feel it because the temperature is low, and if anything cool, then you get sensitivity.
Okay, okay. Now, we also would like to know that how to recognize now caries at the earliest. Now, first of all, what exactly is the term caries? For the benefit of our viewers, what is the term said?
Yeah.
In general, if we want to know about the meaning.
Caries is the primary disease of the teeth.
Okay, primary disease.
Primary disease. So, caries usually occurs because there is a softening of the enamel, destruction of the enamel, then it goes beyond dentin, and then it involves the pulp. So there are three stages where we can avoid caries actually. First, maintaining of oral hygiene properly, then you don't get caries. But if at all your enamel shows a black spot, then you can directly go to the dentist, get it filled. Then it won't cost you much.
Okay.
Then after, if you ignore that, then the caries develops and penetrates the dentinal layer. Then you get a mild sensitivity. If you ignore that also, then it goes down to the pulp, and then infection occurs where you excruciating pain occurs.
Okay, so step by step it becomes very crucial. Okay.
Very crucial. And there are, you can avoid it. You can avoid it at different stages.
Okay.
And it will cost you less. But if it at all involves the pulp, then you'll have to go for root canal treatment and other such treatment.
So things will become worse if one doesn't detect the problem at the earliest. Now, what is the mode of detection of the problem earlier? Like if we want to know how to recognize caries, how will person understand that they have to go and immediately see a dentist?
Actually,
will there be a pain? Will there be, what are the basic things?
There definitely will be, like for in the initial stage, you won't even know that there is caries.
Okay.
When it attacks the enamel layer, you won't even know. Provided you check your teeth daily, like we check our face. So standing in front of the mirror, we always check whether we are looking good or whether there is a pimple or anything. So we recommend the patient to check even the teeth. So for any black spot, if you immediately consult the dentist, then it's good for you.
Okay.
But the thing is, first we recommend annually everybody should do a scaling. Scaling is like, first you consult a dentist whether you need a scaling or not, whether the oral cavity is okay or not. So if the dentist sees that you don't have any accumulation, then obviously he won't advise you for scaling. But if any kind of spot he detects, then he'll let you know. It should be
what has to be done.
Yes.
All right, viewers, we'd like to tell you that our numbers are flashed on your television screen. So if you have any queries regarding your teeth, we are talking about the sensitivity of teeth in cold, but anything related to dental care. So please call up and ask your question. Dr. Banashri Bordoloi is with us, so she will probably give you all the answer. Now, doctor, coming back to you again. Now, if we want to know, we have an idea about the basic things and how to detect caries. Now, if we want to know about the correct brushing technique, now that is very important for everybody, be it a tender age or any age we are talking about. So correct brushing technique is very important.
Yes.
And how many times?
So we advise every patient that everybody should do brushing twice a day. At night, it's very mandatory to brush your teeth correctly. There are actually 4 golden rules of maintaining your oral hygiene. We recommend that even if you don't have time in the morning because of your rush to work, then you can always take out time during bedtime, you know, before going to bed. You first do brushing, then go for flossing, then you should also clean your tongue, and then use a mouthwash and then go to sleep. So there is a correct brushing technique that we also didn't know before we, got into this dental college dentistry. There is a correct brushing technique. Now people can actually find it out. There I have actually given you a picture.
But that pictures will give us a proper idea about
it. Yes. How to brush your teeth. There are 5 surfaces of our teeth. The outer surface, the inner surface, lingual surface or buccal surface, and then major proximal surface, then distoproximal surface, and the occlusal surface, which is like the surface with which we grind our teeth, grind food. So that is also there. So we should clean all these 5 surfaces. So only brushing won't do. You should also do a flossing, and then mouthwash is mandatory because it ultimately gives you a cover, protective cover. When the mouth is inactive, when you sleep, then it gives a cover because our mouth is full of microorganisms. They are lurking there to just sit down even on the nanoparticle of food that is present. So you won't even know when this process starts. So if you do a mouthwash after brushing and flossing, then you get the full protection.
So now this was the brushing technique. So what about the flossing technique?
Floss is a thread actually. It's a thread with which we clean the proximal areas. Like between the 2 teeth. The bristle of the brush doesn't properly clean it. So there is probability of presence of nanoparticles of food material, which might give rise to caries. So in order to clean those areas, you just insert the thread inside.
Any kind of thread. It's not only...
No.
Or you have to have a proper dental...
thread. It is a floss. It is floss because that floss actually, it appears to be a thread, but when it is inserted, it opens up into a thin kind of a sheet. It cleans properly.
That's actually properly meant for the tooth. All right, doctor, we'll talk more on this. We'll have more conversation, but we have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Banashri Bordoloi, consultant dental surgeon, on the topic sensitivity tooth in the cold days. Now, Doctor, coming back to you again, we had an idea about the techniques of brushing. We had an idea about the flossing techniques. Now, if you want to know about this root canal treatment, many would want to know about it. There's a lot of confusions out there in their mind. That, and you were also talking about this scaling. People think that if they go continuously to dentist for scaling, maybe after 6 months or maybe after 7 or 8 months, then their teeth will become thin. Is it so?
No,
or
no.
what is the thing?
Actually, scaling is a dental treatment.
Dental treatment.
If at all it is a treatment, then it cannot be a, distractive process. It will benefit you.
Okay.
So scaling is done to remove the stones and stains of the teeth. It actually cleans the stones so that it doesn't accumulate and destroy the integrity of the teeth.
Okay.
Like stones usually accumulate beneath the gingiva, gums. So when it accumulates, it depends, and then resorption of the surrounding bone structure gets, lower and lower for the lower teeth, and it for the upper teeth, the bone goes, up, and it exposes maximum tooth structure, and it makes your teeth mobile eventually.
Okay.
So what we can do is, if a thin layer of stones and calculus, what we say in medical term, calculus and stains deposit on your teeth, then you should always clean it.
Okay.
First thing, to avoid the destruction that is going to happen. And secondly, for your cosmetic purpose, you look good also with
Right.
white teeth.
It builds up your confidence also.
Yes, right. So
Okay.
scaling is a treatment procedure. It does
and
not.
root canal treatment?
Root canal treatment is a treatment which we do when your tooth is like, it involves the pulpal tissue, and there is infection, excruciating pain, and then to get rid of that, what we do is we take out the pulpal tissue, the soft tissue of the tooth,
Okay.
clean it properly, and we pack it with a non-toxic material. The tooth is there, but it does not, it won't have any sensation. It
Okay.
won't have any sensation. It is basically a dead tooth, but it is functional.
Okay. Now, will you tell about the steps of this treatment? Like if a patient comes to you for the root canal treatment, so what is the first thing do you do, and what are the prescribed things you put on the patient?
So, first, when the patient comes with lot of pain.
Lot of pain.
So, when that patient comes, we check the tooth. If the tooth structure is intact, but he or her is having pain, then what we advise is they should go for a root canal treatment.
Okay.
Root canal treatment, it is like nowadays it is a one-day single visit treatment.
Okay. Okay.
In a single visit only, we do a root canal.
Is it also something that you put the patient on antibiotics for some days and then you call them for the treatment?
Yes, during actually some dentists, it is their preference whether they want to go for a antibiotic coverage prior to this treatment, or some open up the canal and do the treatment and put the antibiotic thereafter.
Single day affair?
Yes.
Okay.
Yeah. So it depends on the doctor how he or she wants to carry the treatment. But both are correct.
Okay.
It's like you can just get the patient relieved of his pain by opening up the canal, because there is tremendous pressure by the accumulation of pus and infection inside the bone, actually, periapical area. So you can get the patient relief of the pain by
So how
opening
long does this entire procedure of treatment takes place?
It If it is a single visit, then it will take about 1 hour, 45 minutes to 1 hour of treatment.
Okay. And there will be, of course, there will be some precautionary measures that one has to take after the treatment. So what are those?
Yeah. After you do a root canal treatment, we always advise the patient to wear a crown.
Okay.
Because
what is that?
It is like if you do a root canal treatment, the tooth becomes brittle.
Okay.
It can easily break. So in order to protect the tooth, you have to wear a crown so that the pressure that is put into the teeth while grinding food, it transmits to the crown, not the actual tooth.
Okay, okay.
Actually.
So it's a shield kind of thing for
yes,
the teeth.
yes.
Okay,
it's a protective
measure.
Yeah.
Okay. And also on the dietary part, you also suggest them to have light food, or is it okay with whatever?
It is okay. We just tell them to actually avoid very hard food until and unless they wear a crown.
Okay.
The crown we prescribe after 10 days of RCT treatment. So that is it.
Okay. Now, if we talk about the sensitivity of tooth in cold days, does it last for long? And if it lasts for long, so people might face a lot of problem. So on that note, what do you suggest the patients? What would you like to tell on this?
In winters, we usually advise patients not to have ice cream if you have sensitivity. So cold food you should avoid as far as possible.
Okay.
People with hypersensitivity, we advise them to take warm water.
Okay.
Yes. And then hypersensitivity we can avoid by giving them desensitizing toothpaste.
Okay.
Desensitizing toothpaste are used in a proper manner actually. People just think that if they brush with desensitizing toothpaste, then they'll get rid of hypersensitivity. It is not the case.
Okay.
You'll have to brush your teeth with the proper commercial toothpaste with detergent, you know, foaming toothpaste.
Okay.
You just clean the smear layer of saliva that is there, and then you apply the desensitizing toothpaste over the sensitive teeth. Yeah, and then keep your mouth closed for 10 minutes.
Okay.
So that it gets absorbed into the dentinal tubules and block the sensitivity.
Okay, okay. Now, if we want to know about the basic symptoms would be if a person is prone, it's not like suiting the cold water, if he or she have those. So the sensitivity measure will rise, isn't it? So what would be the basic symptoms of the sensitivity of any person who is having this problem? What would be that? How will that person understand that my tooth is sensitive to cold or hot or whatever?
First thing, the tingling sensation, the mild tingling sensation they would feel, that is the starting point.
Starting point, the basic point.
Yeah, basic point. And then and there, if they take care,
okay,
then it won't progress further. But if they don't, then it becomes more excruciating, so much so that they think that it is a tooth pain.
Okay.
Because of infection. The hypersensitive teeth are extremely painful.
Okay.
And it becomes very difficult to distinguish between an infectious tooth or a hypersensitive tooth. So we have to take care.
And then rule out the problem, what exactly is the problem. And there are a lot of like products available in the market nowadays, so people opt for those things. They opt for those things and they think that this will heal their sensitivity. So on that note, does dentists like you will suggest them for a prescribed products which is available in the market or not? What would you like to tell?
Actually, it is not that we want patients and come to us. It is like years of experience. When people should always come to the dentist and take the suggestion, not go for random, you know, advertised products. And there is always a procedure of how to use it that you don't get, you know, if you buy from somewhere and apply according to the advertisement. detection of the proper problem is necessary before you use anything actually.
All right, doctor, we are really short of time. So what kind of tips you would want to give, a prevention measure you want to give for a proper oral hygiene to our viewers?
See, many patients come because of bad breath.
Bad breath.
Yes, bad breath occurs because of accumulation of stones and stains.
Okay.
So people should always do a scaling once a year.
Once a year.
Theoretically, we say we are taught to advise the patients 6 monthly, but we say even if they come once a year is fine. And clean the accumulated stones and then go for those 4 golden rules. Brush your teeth twice a day, that is the thumb rule. Brushing should be correct and that is there.
Okay.
So, and also cleaning of your tongue is very essential.
Absolutely. So this is all basic things one can do in their day-to-day activity as well. So thank you so much, doctor, for those lovely tips for our viewers. And viewers, with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.